Good morning, everybody. Sorry we're off to a little bit of a late start. That is my problem, the joys of working at home with dogs. So I want to thank you all for joining us. Today we're going to be talking about the different ways our state legislature could and should be helping us and different things that they can be doing. And thankfully I was able to get Mr. Marc Stier. He is the director of the Pennsylvania Budget and Policy Center. He has so graciously given his time to us this morning. Prior to being the director of the Pennsylvania Budget and Policy Center, Marc was the executive director of Penn Action, and they work to protect funding for education, women's health care, and expanding Social Security. Prior to that, he was the Pennsylvania Director for Healthcare for America Now. And prior to that, he was the Healthcare Campaign Manager for SEIU Pennsylvania State Council. So he has a very long and wonderful career in activism and working for the people of Pennsylvania, which is amazing. For those of you who aren't familiar with the Pennsylvania Budget and Policy Center, they were launched in 2007. They're a nonpartisan statewide policy research project of the Keystone Research Center. And they provide independent analysis on the state budget, state tax, related policy matters to those two things. And they're always focusing their attention on how these policies impact the working people of Pennsylvania and their families. So they do really important work, and I'm really thankful to have you here, Marc. And this is like such an uncertain time, right, for everybody. And everybody's looking for ways that we can make it through, because the businesses are closing, we're ordered to stay at home, we don't know when the next paycheck is coming. So this is a really important topic, because a lot of us don't know exactly what our state legislators and the federal government can do to help us. So thank you for joining me. And I guess we could just start on that topic. Like the importance of this social distancing and these business closures. They are causing a hardship for a lot of people, but they are important. And I was hoping that you could kind of talk us through why that is.
Sure, and thanks very much, Patty, for having me join you. Well, we're putting up a blog post today that's going to suggest that the business closures and the social distancing might be working. It's a projection of what the COVID-19 crisis is going to look like in Pennsylvania. If you've been following the news, you see the line of cases has been going almost straight up recently. The line of deaths, sadly, has been going straight up. What this study projects is that thanks in part to the social distancing, the business closures, we should see a high point reached in the middle of this month, around April 17th and 18th, and then we should see a slow decline. Again, look, no one knows for sure what's going to happen. If you were just to project out what we see happening up to now, it would be very scary, because everyone needs to remember the social closures and the distancing haven't really had an impact on the numbers yet, because people who were infected 7 and 14 days ago, and we just started the social closures, social distancing and business closures very recently. But what this projection shows is that we will have maybe about 3,000 people die in the state. As horrible that is, we could have had 10 or 15 or 20 times as many if we hadn't taken these really stringent steps. So that's good news, despite the sadness about how many people are going to die.
It is good news, and I think it's important to remember that we can always get through this financially, right? The state and federal governments are definitely working hard to help us, but once someone is gone from this disease, we can't get them back. So we've got to put our focus on the human lives, because everything else is not as important as that. I mean, these, everybody that is getting this disease and dying from this disease, it's somebody's family member, someone's loved one, someone's mother, father, sister, etc. So, as hard as it is to close businesses and keep people separated, I really do think that Governor Wolf made the right call. And for those people, who say, "Oh, it's a political thing," I think that doesn't hold water, because there's a lot of Republican governors out there doing the same thing. So, we need to step aside from the politics of the situation and just realize that, lives are here at stake. So, I'm happy to see that that's actually doing some good, and that we are hopefully closing in on the worst of it. So
yeah, I think so, and I think
yeah,
you're right. Health and lives take priority.
absolutely. And
The other I'm sorry, go ahead.
oh, I was going to say, can you kind of explain why there's a lag? Like we've been social distancing now for 2 weeks, but the numbers keep rising, and I think some people think, well, that's evidence that it's not working.
Well, the reason there's a lag is because the incubation period for the disease is 7 to 14 days. So people who are getting sick today or being hospitalized today most likely got the infection 7 to 14 days ago. We didn't really go to full closing of businesses and stay-at-home orders until March 22nd. That's only 8 days ago.
Yeah.
So we are still seeing the impact of what was happening before that. What we think is going to happen is over the next week, we're going to see a decline in the rate of increase in cases. We've already seen a bit of a decline. It was up it was almost increasing 40% a day for a while. It's down to about 23% a day over the last 3 days. I'm expecting it to drop a little more and gradually go down. And that will kind of limit the number of people who get the disease. It'll also protect us from overwhelming our health system. There's some worry that by the middle of April, we may run out of ICU beds, about 18 days from now. That gives the hospitals, however, time to make arrangements to get more equipment into place. And we're fairly hopeful that the hospitals in the state will be able to take the necessary steps to treat everyone. And if the projection's right and the worst happens around the middle of April, then we should start seeing a decline in cases and a decline in pressure on hospital care.
Yeah, and that's another important thing. We need to have hospital beds available for the people that need them. So yeah, you're right. That's another important piece of the puzzle. So right now, for people who are wondering, the federal government just released their stimulus package or their aid package. Can you tell us what the state is doing? And I don't know if you can or want to touch on that federal policy at all, on how it affects us now.
Sure, I will just a bit. Obviously, the federal government has much greater resources than the state government to address what is really the critical economic question is, how do we prevent this business closure and social distancing period from falling very heavily on people with low incomes, people who are Black and brown, people who are disabled, women, and so forth. And how do we ensure that as soon as we can get back to work, the economy hasn't collapsed?
Yeah.
So the federal government's taken some major steps, and the state has taken steps in concert with the federal government. Some of the big things in that bill that passed last week is unemployment insurance. The federal government has basically extended unemployment insurance for 4 months with a possible extension beyond that. And even more importantly, it's raised everyone's benefits by $600 a week. So whatever you were entitled to under state and federal law previously, you get that plus $600 a week. The goal was to ensure that the average worker would not lose anything.
Right.
And I think that's a really important accomplishment. Another important accomplishment is that gig workers, the self-employed, are now eligible for unemployment insurance and will also get that $600 a week. So the people who are working and been laid off, so many of them are feeling the economic pressure today, but unemployment insurance should be helping them. What the state's been doing is it suspended the weekly waiting period So as soon as you're unemployed, you can file. You don't have to wait for a week. It's waived work search and work registration requirements. It's made it easier to apply for unemployment insurance. You don't have to go in to talk to anyone. You do it all online by phone, and that's going to be really important. Other thing the state's doing is it's helped make SNAP, what we used to call food stamps, easier to get. Applications have been expedited to 5 days. School districts are distributing meals at no cost in many places around the state. All that's being very helpful to people as well. And again, the state's taken efforts to make it easier to get these programs and to not require meeting anyone. You can do it online or by phone call. The state has delayed utility terminations, basically prohibited during the course of the emergency. So you can't pay your electric bill, your natural gas bill, your water bill, or your wastewater bill, you won't get it turned off. And the Supreme Court took an important action of prohibiting all evictions from either banks or landlords. So if you can't meet your rent or your mortgage payment in the next month or two, you're in no danger of losing your home or your apartment. So all that's really important. And it's things the state government's taken. A lot of it's just administrative things that the governor could do by himself. Some of the Supreme Court ordered. And then the state legislature has taken a couple of actions, basically putting into law some of the regulatory changes that the governor ordered with regard to unemployment insurance. They've delayed the primary to June 2nd, which is, I think, a really good thing. And I should also add that Governor Wolf has created a fund to help small businesses through the Industrial Development Authority. There's a big fund so small businesses can apply for low interest loans to tide them over this period as well. And that's in addition to the federal small business loan program, which is part of the legislation from last week. So the state's been taking really aggressive steps to try to limit the damage of the business closures and social distancing on our economy, and particularly for those most vulnerable to economic stress.
Yeah, and I think it's really helpful that they're focusing on both aspects of it, you know, the small business owners and also the employees. A lot of times, I think government has a tendency to focus on one or the other. Right. And sadly, I think a lot of people get left behind, you know, in that scenario. So I'm really happy to see that they're focusing on both because while the big businesses are important, obviously, you know, the Walmarts and the other types of that kind are important. It's really the small businesses, I think, that are the backbone of our state. And we need to definitely focus on them and make sure that they're still around, you know, after this. So
right, that's absolutely right, and I think you're right. We've done both, and that's really important.
Yeah. And I know sometimes that the legislators get a bad rap, but I'm really happy with what they've been doing. Are you satisfied with it? Do you think that there's more that they should be doing?
We still have some concerns about certain things. I'm actually worried about public health spending. One of the goals of this period of closure is to reduce the rate of infection so that we can then, as infections come back, and we know they will, when we start being in touch with one another again, the infection rate will pick up again. The only way to avoid another period of business closure and social distancing is to track everyone who has an infection, track their contacts, do the kinds of things that we've always done before with regard to infectious diseases. I'm concerned that we don't have enough public health funding in the state to do all that. I'm trying to look into more detail at how those programs are working. I know the state really hasn't been doing contact tracing right now just because they're so overwhelmed. One of the things that concerns me is we rank 45th out of 50 states in terms of public health spending. And the amount of money that the General Assembly appropriates for public health spending hasn't changed since 2008.
Wow.
So I would encourage our legislators to be putting more money into the public health programs and building up staff so we can actually try to avoid another period of shutting down the economy keeping everyone at home. It might still happen, but the more aggressively we can track people who have the disease and find who they've been in contact with, then we can quarantine them and the rest of us don't have to be quarantined. The other things we're looking at is we think it's time to increase benefits for temporary assistance for needy families. It hasn't been increased in over a decade. This is a time when people need the money, and we'd like to see them do that. Over the longer term, there's some really important provisions that we've been calling for years that if they were in place now would really be helping people. You know, we've been calling for paid family and medical leave for a long time. With a very small tax, we could build up a fund so that when people are sick or have a sick child or sick parent, they can take time off and get some benefits. It would be hard to start that up right quickly without some state appropriation, but we think the state should be moving on that. And paid sick days. Philadelphia requires them. Lots of other places around the country require them. I think Pennsylvania should be requiring them too. And again, it would be hard to start it up now in the middle of a crisis without some state appropriation, but it wouldn't take very much money to put those policies into place.
And I think that just shows the importance of something like that, you know, because sometimes those can be seen as, you know, just political talking points, you know, oh, we want to increase the minimum wage, or we need paid sick days. But when something like this happens, you can really see the importance of it, and it becomes not a political issue. It becomes a people issue, you know, because if we would have paid sick days here in the state, maybe this pandemic wouldn't have gotten off to such a rough start, you know, here in the state, because a lot of people are forced with going to work when they're sick because they can't afford to stay home. And not just in a pandemic, but anytime, you know, flu season, if you're sick and you go to work because you can't afford to stay home, then you're infecting all your coworkers, then they're out sick. It affects the business's ability to operate. So I think a crisis like this really shows those weak points and why they matter. Same way with, you know, increasing the minimum wage to a living wage, because again, same thing, you know, people don't have savings. And who would have thought that we'd be in this position where we're mandatory, it's mandatory to close businesses, and without a savings to fall back on, now we're having to prop up, you know, hey, you can't foreclose on people, you can't evict them because they can't afford their rent. So one thing is never standalone. One thing always ripples through our economy and touches many more things than just that one thing. And I think we need to start realizing that these topics that we're talking about and trying to get past, you know, don't just affect the workers, they affect the business owners too, and it helps them in situations like this. So yeah, I agree with you. It's really important that we start working on those things for the next time, because I'm sure there'll be a next time. Hopefully not soon, but like you said, once we start releasing people back to work and back into society, I'm afraid, like you are, that it's going to pick up again. So
we won't be out of the woods until there's a vaccine.
Yeah.
Or until everyone has had it and we're immune to it. And we don't really want to go down that road if we don't have to.
No,
I certainly don't want it. I don't know anyone who does.
No.
Some people say it's just a mild flu-like
Yeah.
But for 20% of the people who get it, it's very, very, very serious. And
yeah.
I don't know if anyone's ever had pneumonia, but not being able to breathe is not fun at all.
Yeah. Well, and then you have the compromised people out there who it's 10 times worse for. So yeah, absolutely. So
I would just add one other thing we're looking
Sure.
for, and that was the General Assembly moved the primary. They made some provisions to reduce the number of polling places, which I'm actually concerned about because it's hard enough in some places in the state to get to the polling place.
Sure.
We have mail-in ballots. I think the state should take the next step and mail everyone a ballot.
I do too.
For June and for November, because our elections are critical to our democracy. We got to make sure as many people as possible vote. So I would add that to my list for what the General Assembly should be doing.
I agree with that 100%. I mean, this is not your typical election year. And I think that you're right. Just just go and mail the ballot to everybody. Let them vote from home. Let it be safe, because I do have a lot of rural areas in my district. I know a lot of people do, and they're spread out now, the polling places. So you start consolidating them, and you're right. It's going to be hard for people to get there or find it.
Right.
Sometimes it's just a PO number, and it's like,
Right.
when you ask Siri where that is, she's like, well, I don't know. So, with all of this going on, and all the money that the state is helping with, and the federal government is helping with, how does that affect the budget for this year? I mean, do you think they're going to pass it on time? And do you think, with the significant lack of revenue coming in, because obviously state tax revenue is going to be down, local and state taxes aren't due now until July. So how do you think that's going to impact the budget this year and next year?
I think we're heading into a very serious budget crisis, and I don't know what the General Assembly is going to do. To be honest, I'm not sure anyone knows at this point. There hasn't even been a lot of discussion about it, because everyone's focused on the immediate crisis. But it's our job to be looking ahead a little bit.
Yeah.
And we came up with an estimate last week of what the hit to the state budget will be, both in terms of reduced tax revenues and some mandatory expenditures. Lots of people are losing their jobs, they're losing their health insurance, they're going on Medicaid.
Yep.
And thank God that's there, and thank God they have a right to it, and state and federal government have to pick up the cost of it. But between the loss of tax revenue and added expenditures, we're looking at about a $5 to $10 billion hole in the state budget between this year and next year.
And you said billion with a B, right?
With a B. Now,
Yeah.
keep in mind, the general fund budget is only $36 billion a year. So we're looking at 15 to 20% of the state budget. But, well, since it's a 2-year budget, so it's 2 years, it's about 72 billion, and our prediction is we're going to lose about 5 to 10 billion over those 2 years. So it's about 5 to 8% of what we were expecting to spend in this year and next. That's a very, very serious problem. The federal government recently gave states a bailout, but it only was about $4 billion, which means the state is $1 to $6 billion short, depending on how bad it gets. And I'm giving a range because no one really knows how bad the recession is going to be, how long it will last, how quickly we can recover. But I tend to be a little pessimistic about this. I think it's going to be a very deep recession. I don't think it'll last that long, but it's going to be very deep. And I'm inclined to think that we're going to be up about a $10 billion budget hole. And we're going to need more revenues. Hopefully the federal government will come in with more. What we're telling people is the thing the state cannot do is what it did in 2010, 2011, and that is start cutting healthcare and higher education and K-12 education. We tried to balance the budget back then doing that, and it was a disaster for the state's economy.
Right.
Over the next 10 years, our state grew more slowly than most other states in the country. Job growth was very slow. We can't go down that route again. So we have to avoid very serious budget cuts.
How would you propose that they make up that gap? Do you have any ideas on that?
Well, first thing we do is we and every other state go hand in hand to the federal government. Federal government's allowed to borrow and run deficits. The state is not. So it's really the federal government's responsibility to come up with funding. If it's not enough, I would say we need to tax the people in Pennsylvania who can most afford it. One of the sad things about Pennsylvania is we have a totally upside down tax system. If you look at people at the bottom 20% in the middle, they pay 11 to 12% of their income in state and local taxes. If you look at the richest Pennsylvanians, they only pay 1% of their income in
Wow.
state and local taxes. So we have a proposal called the fair share tax that would raise taxes just for mostly for people in the top 1% and 5%. Would actually cut taxes for people for about 60% of Pennsylvanians. And what we're saying is if we can't get enough money from the federal government, we need to ask the richest Pennsylvanians, at least temporarily, and given our upside down tax system, I would say permanently, to pay their fair share and ensure that we don't have to cut education and higher education and healthcare to balance the budget in this crisis, like we did 10 years ago.
Yeah, and look where that's gotten us, right? Nowhere. We're desperately trying to keep our workers here. You know, they get educated, then they leave, and we have, like you said, one of the worst funding in education throughout the country. So yeah, we can't keep down that road, because if we cut more, then we're going to be even worse. You know, they've got to start looking at places, like you said, where they haven't looked before. And I worry about an increase to the sales tax too, because you know, that also impacts the lower income people more, because a $100 sales tax bill is more of their income than it is for somebody who makes 100,000. So I agree with that.
We oppose the sales tax increase. We think, you know, we have an unfair income tax. There's a way to fix it. Raise a little bit more money from the top 1% averages $1.6 million in income a year. And the kind of increase we're talking about would barely be felt by them, but it could raise enough money to tide the state over until the economy recovers. The other thing is, if we cut taxes for people with low and middle incomes, that's partly relief for this economic crisis. It also is money that when they get it, they will spend it immediately. You know, it'll be part of an economic recovery package for the state.
Yeah, absolutely. Well, thank you very much for joining me. I really appreciate it. Is there any other thing you'd like to leave us with, or anything you haven't covered?
No, I mean, this has been really comprehensive. Thanks for asking me those questions. And I think we talked about really most of the major things going on at state government right now in this crisis.
And hopefully it'll pass soon. Hopefully your predictions are right, that we're about 2 weeks away from the worst. And, you know, hopefully we can get back to work soon. But if not, like I said, lives are definitely more important than dollars. And at this point, we're just going to have to do what we need to do. So.
Yeah, I wouldn't expect that we can leave our houses and go back to work in 2 weeks.
Yeah.
I think it's going to take a couple more weeks after that to ensure that the virus stops spreading. But I'm hopeful that the worst of it isn't going to be in a couple of weeks. Again, you know, no one really knows, and I could be wrong, but I thought, given I saw this study offering people a little bit of hope that we may actually be getting this under control is worth my being wrong in case in 2 weeks. You won't hold me to it if it turns out it's 3 weeks. I'm sure.
No, we won't. If anybody wants to read more about your policies that you'd like to, you know, that you were suggesting or that you were talking about, where can they go? Do you have it on your website or Facebook?
A lot of this is on our website. It's called KRC-PBPC, Pennsylvania Budget and Policy Center. .org, and we've been blogging about this every day. Some of the things I just talked about today will be coming up in new blog posts this afternoon, so you'll be able to see some of these things. And
you have a Facebook page as well?
We do have a Facebook page, Pennsylvania Budget and Policy Center.
Okay, perfect. So go there, everybody. Read about Marc's ideas. They've got some really great ideas on how to bring our state back online and how to make sure that we do it fairly. So thank you so much for joining me. I really appreciate it.
You're very welcome. Anytime.
Stay safe.